Hello there! Today, we will be going over AIDS. This video will cover AIDS, its history, how it can be transmitted, and how it can be prevented. Let's begin. So, what is AIDS? AIDS stands for Acquired Immunodeficiency Syndrome. It is a condition caused by the human immunodeficiency virus, or HIV. By damaging your immune system, HIV interferes with your body's ability to fight infection and disease. A person with HIV is considered to have progressed to AIDS when the number of their CD4 cells, which are a type of white blood cell, falls below 200 cells per cubic millimeter of blood. Now that we know what it is, let's explore its history. In the 1920s, a form of HIV called simian immunodeficiency virus, or SIV, was present in chimpanzees. Over time, the virus mutated and adapted, eventually leading to the emergence of HIV in humans. In the early 1980s, a mysterious illness began to appear, affecting primarily gay men in the United States. This marked the beginning of the AIDS pandemic, a disease later identified as caused by the human immunodeficiency virus. By the late 1980s, AIDS had become a global health crisis. The lack of effective treatments and widespread fear led to stigmatization, discrimination, and the loss of countless lives. In the 1990s, advancements in medical research resulted in the development of antiretroviral therapies, or ART. These medications helped slow down the progression of HIV. The early 2000s saw a significant shift in global efforts to combat AIDS. International organizations, governments, and advocacy groups began working together to increase access to HIV testing, prevention programs, and treatment options. The impact of AIDS has shaped the way we approach public health, fight discrimination, and support affected communities. By learning from the past and working together, we can continue making progress towards ending the AIDS pandemic once and for all. Now, with its history over, we can now talk about how they are transmitted. HIV can be transmitted through several routes. First, through unprotected sexual intercourse. This includes vaginal, anal, and oral sex. Second, sharing needles or syringes contaminated with HIV-infected blood. This mode of transmission is common among people who inject drugs. Another important route is from an infected mother to her child during pregnancy, childbirth, or breastfeeding. Lastly, certain occupational exposures, such as accidental needle pricks or contact with infected blood, can put healthcare workers at risk. Strict adherence to universal precautions and safety measures is crucial in these settings. It's important to remember that AIDS is not transmitted through casual contact, hugging, shaking hands, sharing food and drinks, or using the same toilets. Now that we know how they are transmitted, how can we prevent ourselves from getting HIV? The most known method is using a condom. Condoms, when worn properly, provides a barrier between the penis and the vaginal fluids. It also collects semen after ejaculation. This means both partners will be unable to get HIV from each other. Another way is male circumcision. Male circumcision is when the foreskin of the penis is removed. This is because the moist area under the foreskin promotes infection persistence. Without this area, the chances of getting HIV and other sexually transmitted diseases greatly decreases. You should also remember to never share needles with another person as they may have HIV. Finally, to ensure you don't have HIV, you should take a test whether at home or at the hospital. Now we will talk about what to do when we get HIV to not let it develop into AIDS, which will be taking PEP or PrEP. PrEP, or pre-exposure prophylaxis, reduces your chances of getting HIV from the usage of drugs or sexual intercourse. It should be taken if you have injected drugs or had sex with a partner with HIV for the past 6 months. The two methods of taking PrEP are through pills or through shots. The side effects of PrEP are diarrhea, headaches, nausea, fatigue, and stomach pain, but they will go away over time. Now moving on to PEP. PEP, or post-exposure prophylaxis, is taken when you think you have been exposed to HIV within 72 hours and should be used in emergencies only. Some side effects of PEP are nausea, fatigue, and headaches. PEP is not suitable for regular use and should be switched into other HIV prevention methods, such as PrEP stated previously after taking it for 28 days. That will be it for this video. Please share and leave a like if you're interested so more people will be more informed about AIDS.